Welcome to Burn the Ship. This is the podcast where we connect entrepreneurs or professionals that can help you go all in on your business. We talk to people that have walked the walk, talked the talk, been through all the things that we experience as entrepreneurs in the small business world, and have come on the platform to share those experiences with us so that hopefully we can run a more successful business. So, thank you for coming. I appreciate your time. Anybody that shares some time with me, shares time with the audience, is prepared to lend us your experiences so that we can learn from those things. It really does mean a lot to us. So I appreciate your time today. But yeah, I'm Bailey. I'll be your host. And if you wouldn't mind, please introduce yourself. Tell us a little bit about your business.
So my name is Dr. John Jacobsen. I'm a family physician in Kearney, Nebraska. Uh, Medicine's a second career for me. I was a banker, ag banker for 10 years and then went back to medical school and did the fee for service world where we took insurance, Medicaid, Medicare for 10 years and really got burnt out on what we call the system and decided to do what's called direct primary care, which is a membership-based model. So based upon your age, people pay us X number of dollars a month, and we provide their health care for them. We
Nice.
essentially, when people do that, they become a cash pay patient. So people have more people have insurance than don't with us, but they're typically high deductible plans. So we provide the day-to-day care. We can provide, 90% of a person's care if you need to see a specialist or we need to be in the hospital. We talk about how you can negotiate those bills with the hospitals, how to get a cash price for the specialist. And when we opened almost 7 years ago, in our town, there are two hospitals. Nobody had a cash price. Now the hospitals plus most of the specialists, well, all the specialists have a cash price for us.
Nice. And so the need for direct primary care, is that somewhere popping up everywhere? Because I know we talked a little bit about the amount of people that were uninsured or underinsured in the Nebraska area, and for the people that are new to the podcast, my little brother played football in Crete, Nebraska, just outside of Lincoln, and then lived in Lincoln as well. So it's I've spent some time there, and I was wondering if kind of the need for your industry, is that something that's popping up everywhere? Is this direct primary care a new kind of business model, or what kind of what
Sure. I
are you
mean,
kind of cutting the
it's
way in your
fairly
space,
new.
or?
There's been different versions of it for 20, 25 years. Most of those ones were based more for a large employer. And so it worked great until the employer decided they didn't want to do it anymore, then those physicians were out of a job or their company went bankrupt. Direct primary care really focuses more on, for me, focuses more on small businesses, 25, 30 employees or less. It also is great for uh, people who have high deductible plans, have kids. And what it really allows people to do is base their health care on a monthly basis versus 2 or 3 times a year getting a huge bill when they go do something. In 2017, I went to a meeting in Florida and there were like 330 direct primary care clinics across the US. Um, Now it's pushing 4,500 to 5,000 in 5 years.
Wow.
What you're seeing is physicians who get burnout on the system. Um, Here in Kearney, if I worked for CHI, which is a large healthcare system, as a family physician, they'd expect me to see 24 to 27 people a day. So that's one every 15 minutes. And you cannot
Right.
provide good care doing that. You can't build a relationship doing that. So the direct primary care model is you back that off. We have 950 patients in our two clinics. So we have the time to sit and talk and get to know our patients. But the trend continues to grow, kind of exponentially over the last couple of years, just because physicians are getting burnt out. A physician a day kills himself across the U.S., which is
Wow.
is crazy.
Wow. I didn't
But
know that. That's
yeah,
wow.
there's just so many physicians getting burnt out. Most physicians are perfectionists, and we want to do the right thing. We want to, get our charts done. We want to do the best we can for our patients. But when you work for a healthcare system, you typically have to refer inside the network, inside the system. And you may have the worst cardiologist in town, but you're that health system, you got to refer to that cardiologist. So just the overall corporatization of healthcare is driving a lot of primary care physicians out. And then when you look at the regulatory requirements that insurance companies, Medicare, Medicaid put on physicians, they're spending 70% of their time doing paperwork and 25 to 30% of their time actually being a physician. And you get to feel like you're a box checker. And that was a feeling I had when I decided to do this, was very refreshing, that now I could spend, a 30-minute appointment, I spend 30 minutes with my patient. I'm not in there for 10 minutes, and of that, I'm looking at my computer for half of that, not focusing on really what's going on. So it allows you to step back. It allows you to not be a box checker. It allows you to build that relationship again. And in primary care medicine, it doesn't matter whether you're a family physician or you're an internist, or you're a gynecologist, obstetrician, or you're a pediatrician. All of those are healthcare, or all that medicine is based upon relationships.
Yeah, and um the overall desire to help people, I feel like too. It's you kind of get back to the ability to run in a clinic like a small business where the relationships become a lot more important, right? The price becomes a lot more important, and um, how you communicate with the people that are doing business with you becomes more related to a small business than I would relate it to a large hospital, right? So what from that entrepreneur perspective, what's it kind of been like for you guys to get started? Like how do you go about getting that first client, and how do you kind of have to market yourself like a more traditional small business?
You do. So I moved to Kearney almost 7 years ago, and I knew one doctor in town. I had zero patients. And it took me about 3 years to get to my goal of 650 patients.
Wow.
But you have to market yourself. Physicians, you tell physicians you have to be, you're a salesman, and they all will say, no, 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 I don't need to do a sales, but we're selling our knowledge. Every,
Right.
that's what people come to us for, is they want our knowledge so they can get better. So designing the monthly membership, to one, you provide a reasonable cost, but then how do you provide value? So the value comes with, you sign up, you get my cell phone. So you have access to me 24/7, 365 on my cell phone. And I tell my new customers that, you can call me at 2 in the morning, you can call me with a cough, it's going to be a really short phone call. But you call
Right.
me with chest pain, we're going to get you taken care of. So when I started, I mean, I hit every civic organization in Kearney, from the chamber to the Kiwanis Club to the Lions Club to the Rotary Club. And then I went around and started talking to small business owners, because small business owners struggle to provide any kind of health care for their employees. I've had employers tell me, well, I had an employee leave for $1 an hour because they can get, $5,000 deductible health insurance plan. So they're looking how they can provide value for their employees. So they look to us. And that's been one of the things that's been beneficial for us, because when I have an employer sign up that has 5 employees, 10 employees, 15 employees, that adds stability to my numbers. Because families move, families lose their job. I mean, Bidenomics has not been good to us.
Sure.
At 90 plus people in the first 3 months that left us, just simply said, I either got to put food on my table, or I can pay you. And I understand. I'm a father, a grandfather. So that's been the biggest struggle. But the biggest thing is getting past the mindset of, yeah, I'm a doctor, but I'm also an entrepreneur. I'm a business.
Right.
And a lot of doctors shy away from that. I was a banker for 10 years before I went to medical school.
Hmm.
And we always said that the worst people you want to finance were doctors, because they had no clue. They wanted to buy the $500,000 house because they had a salary of 150,000, but they never knew how to manage their money.
Sure.
And so that's one of the struggles I have, because I'm actually looking to have a physician join us. I'm kind of trying to develop an exit strategy for myself, but providing that value is different, because people are taking money out of their pocket and paying me every month. Now, if I have an insurance plan through my employer, who am I working for as a physician?
Right.
Essentially, I'm working
I
for the
mean, yeah.
insurance company,
Yeah.
because they're dictating what we do, how we do it, why we do it, when we do it.
Yeah.
When you take money out of your pocket, Bailey, and you pay me, who am I working for? I'm working for you.
Right.
You and I then get on a whole different level of healthcare, a whole different level of relationship, and a whole different level of, maybe you don't need medicine. Maybe we need to talk about seeing a therapist. This is depression, anxiety. Maybe we need to talk about a wellness program. Maybe we need to talk about whatever to keep people healthy versus, well, I'm not going to go to the doctor. I have insurance, but I can't afford the copay, or I got a $5,000 deductible and I can't afford to pay $200 to walk in the doctor's office. So that's really the struggle kind of on both sides. One from our side is you got to market yourself, but two from our patient side of what can they afford and what do they get for that service. I have people say, well, what do I get for my membership? And I said, well, and I asked them, what do you get for your insurance from your insurance? You get access to see somebody. The difference is you get access to see me. We're one-on-one. We don't have 10 people in the back room that are trying to collect the insurance money. So in my office here in Kearney, I have myself, my wife, who's our office manager, and I have a full-time RN. And I have a person that does my books 2 days a week. In my clinic in Broken Bow, which is 60 miles away, I have a full-time RN that works 4.5 days a week, and me. So we don't have to have all that overhead, so we can keep our prices where people can afford them. Because if people can't afford to go to the doctor, in the end, it's going to cost them more, not only in health and in monetary, but people don't realize how much chronic disease causes people to suffer.
Right.
And when I talk about suffering, whether that's being on dialysis and being on oxygen, having a heart attack and not being able to walk across the street because you get short of breath. So those are the things that we work to really prevent diseases from progressing. Where when you're in the healthcare world or the insurance world, fee for service world, you're really reacting more than anything. You think you're preventing things, but if you get lab and there's an abnormal lab result, they've already got the disease. You haven't prevented anything. You're now reacting to that and trying to treat and play catch up.
For sure. So tell me this: how does that conversation go with a prospective customer of yours? Right, like I am 28. I'm very healthy. I am very active. I'm not allergic to anything. I just don't deal with a lot of things medically, right? But I've gotten to the point now where my own insurance has become a cost to me, and it's to go to the dentist a couple of times a year to get a checkup or to get antibiotics when I get sick, the handful of times I get sick a year because I have young children. So, like, is your pricing transparent? Like, how does that conversation go with understanding exactly what the cost is going to be and what the expectation is for you based on the health that I already have?
The everything we do at direct primary care is more than transparent. And that's a problem with the fee for service world is you come in to see me and I want to draw blood. Well, I don't know what insurance you have. I don't know if your insurance is going to cover it. I don't know where you're at with your deductible.
Right.
You come in to see me, I will tell you exactly what it's going to cost you before I stick the needle in your arm. In Nebraska, we can dispense medicines. I will tell you exactly what it's going to cost you before I dispense an antibiotic for you or your kids. If we're going to do a procedure, maybe I'm going to freeze some moles off, or I'm going to do a vasectomy. You're going to know up front exactly what the costs are, and that's the beauty of direct primary care is the transparency, and that's what our customers love. Not only our employers, but our customers is they know exactly what it's going to cost. And I've had people that said, I can't afford that this month. Can we wait till next month? I've had people say, I can't afford that ever. And it's like, okay, well, what can we do to help them? At direct primary care, another thing I love about it is I have the flexibility that I can give healthcare away if I want. I've had people young families who have called and said, I need to cancel my membership because I can't afford, I just got to put a transmission in my car. And I'll ask them, what's the transmission going to cost you? Well, $400. Okay, so for the next 5 months, I'm not going to charge you. You still come see me because if you don't, you're going to end up in the ER and you're going to have another bill you really can't afford. But we can give health care away. If I take insurance, I can't do that because I have to
Right.
treat everybody the same. So the conversation really starts out of, okay, here's the monthly membership and here's what it covers. We feel like we've done a good job on our website. so people can go and stimulate questions, what's covered, what's not covered. It's also spelled out on our patient agreement that our patients all sign. Think about our membership like a gym membership.
Right.
Sign up, you put a credit card or debit card on file. The 1st, the 15th, or the 20th, we're going to charge your card for whatever that is owed. Our pricing from 19 to 44 is $60 a month.
Oh,
From
wow.
45 to 64 is 85 a month, and 65 and above is $110 a month. For kids with an adult from birth to 19 is $20 a month. So if I have a family of mom, dad, and two kids, that's $160 a month. That's less than one office visit. Kids,
Yeah.
$240 a year. That's less than one visit to go get a well child check. Those are all included in our offer to our customers. We also offer free rapid strep tests. Our urgent care here in town charges $45 for that test, plus $130 to walk in the door. Rapid flu, they charge $95. That's included. We do urinalysis, pregnancy tests, for your sick hemoglobin blood tests. We do those free. I don't want to nickel and dime my patients, and that's what happens when you go to a clinic in the fee-for-service world. Is that doctor has a bill sheet, and every little thing you do, I got a circle because my office has to file that, and we want to make sure we don't leave any money on the table. Well, with us, here's what the price is. Here's what's going to cost you. Here's how long it's, and we set it up and we do it. So it's a really cool situation because there's no worrying about what's this going to cost me. Oh God, I'm going to come in today. What's that bill going to be in 3 months when I finally get the bill? And how much
Yeah.
it cost me? Because up front, when you go to a direct primary physician, what that cost is going to be.
Well, we kind of like boiling it down as simply as we can boil it down. I mean, we love to say, um, you have to work really hard and you have to put your customers first, right? And if you do those things and you understand the value that you're bringing to those people, you've got the beginnings of a recipe for some level of success in the business world. And it seems like you guys are really focused on those things that are also so key to us kind of in my industry. What I've learned that is the most the most effective way to find a way to bring value to the people that you're working with. But tell me this, where do you go from here, right? Because I can draw some parallels to my industry where, like I said, when I joined my company, there were three people, right? There was myself as our first ever salesperson. There was our owner, CEO, and then our other owner, which is our director of operations and all things tech for us, right? And when we got to a certain level of clients or certain amount of clients, there just wasn't enough time in the day for us to service the people the way that we deserved. And so we had to bring on customer service people, which made us want to bring more salespeople and vice versa. So that they always have to grow in congruency with each other in my industry. So tell me kind of that reflection for you, right? Like, what is the goal from here and how far can you kind of go and still continue to maintain the level of relationship that you have with your clients?
Well, right now where I'm at, I'm not really looking at any customers. Um, 950 is pushing the limit. The
Right.
optimal is around 600 to 700 because then everybody. You're able to if they do call you in the evening, you know who they are. So we're pushing that limit, and we're pushing it because I have this second clinic in Broken Bow, which is close to where I grew up, and that's one of the reasons I went back and opened a clinic there because of the need they have. This this model is scalable to a point. Um, I'm not going to tell you that this model is the panacea to the end all to be all because there are people that can't afford it. People that are Medicare, people that are Medicaid, Medicare, Medicaid dual eligible, people who are disabled. So we're still going to have some sort of a government system.
Sure.
And I don't want to talk about socialized medicine because that's not what I'm talking about. But for me, the next step is to try to bring on another physician,
Sure.
preferably a younger physician. I'm 64 and a half, so I'm kind of developing an exit strategy. So bringing somebody on who has that same desire, that same entrepreneur, and typically what we see going into direct primary care is somebody who's been practicing for 5 to 10 years. And just finally, they have a young family, they finally are just at the end of their wits because I'm seeing patients all day, then I come home at night and I do my charts. So I get to spend very little time with my kids, or I'm missing my kids' soccer games, ball games.
Sure.
So for me, I need to find that person to come in that has the same belief that I have. Now, I'm old enough to know that somebody 35 years old is not going to have the same value system I have at 64 years old. But from a customer service perspective, they have to have that. And one of the things that limits physicians from going into direct primary care is they feel like they're going to be on call 24/7, 365, which I am. In almost 7 years, I probably had 20 calls after 11 o'clock.
Right.
Most of those were from the hospital saying, hey, so-and-so's here, can you send me a medication list? So people do not abuse me as their physician because they know if they do call me, we're gonna get them taken care of. At 4:45 on a Friday, somebody calls and they've got something going on, it's get in here, or let's do a video visit, or, let's take care of you. I'm not gonna say, go to urgent care, go to the ER, because that's the last place you wanna be, because that's the worst place you get healthcare. Because
Right.
they know you and they're, urgent cares will write prescriptions for anything.
Sure.
So for me, trying to get a young physician to come on board, trying to educate medical students, trying to educate residents, continue to educate in my community about what we offer to business people. Because the more that spreads, the more demand there's going to be, and there's plenty of demand. It's just more now we need to find the physicians to do it. A lot of people will say, well, why don't you get a PA or nurse practitioner? And I use the analogy of if you're a business owner, typically you have an attorney.
Right.
Sometimes you need an attorney. Do you want to talk to the attorney or do you want to talk to the legal secretary?
Yeah.
And most people want to talk to the physician. Um, they're paying money out of their pocket. For their money, they want to talk to me as a physician or a physician. They really don't want to talk to a PA or nurse practitioner. So I've not went down that route of hiring. I could bring a PA or nurse practitioner on and probably continue to grow some, but I would rather keep the level of service, not only customer service, but always also the knowledge level of a physician providing care than working or having a mid-level who, you know, and I'm not saying anything bad against the mid-levels because they're an important part of the team, but to be practicing independently, that's where I struggle with the mid-level.
Sure. No, that makes a lot of sense. And just from a consumer perspective and from a business perspective, like you really don't want to be in that place where you're deciding between money and going to the doctor, right? Because that was the place that I was in as I turned 26 and was didn't have insurance and would get sick and so do I go pay out of pocket for who knows what is going to end up being this bill for whatever antibiotic or treatment that I may need. And just having the ability to go, oh, if I have questions, if I need to ask someone the question, the ability to at least know what that solution looks like and know that that solution isn't going to create unclear cost in your life is a very peaceful thing, right? And then for your business perspective, it's kind of the same thing. It's like you have the solution for the competition that you're enduring in your industry, where like you talked about, people will leave for $1 an hour because they can get an insurance plan that literally doesn't directly correlate to their ability to see a doctor and maintain themselves financially for normal things, right? Like it's it's a solution that I really understand the need of where it fits in for normal people like myself, right? And I understand the value that it has and I understand the exact use case that it has for me. So I think you guys are doing an incredible job both of demonstrating what it is that you do and of the value that you bring to the people that are working with you. And for that, I applaud you. And additionally, it seems like you have the people that you're working with in the front of your mind, right? The way that those people feel and their health on a day-to-day basis and their relationship with the person that helps them take care of themselves and their family, it seems like people have nothing but good things to say about you, and that you've continued to kind of push yourself to adding more clients and making yourself more readily available for people that want to work with you. So it seems like you're in a great place. And if there's anything that my organization can do to supplement those efforts, please lean on us. It's a really cool thing that I think that you're doing, because it's something that you don't hear about here. I'm just outside of Atlanta, and direct primary care was a new concept to me until the first time that we had talked, and I really got to understand this is what it looks like for people in this phase of life, to be able to take care of the most important stuff to them, which is their health and their body and their families. You know what I mean? So it's a really cool thing, and I applaud what you've done from a business perspective, because I know it's not easy to talk about what it is that you do, in front of people that are ready to listen, until you're unless you're going out networking, actively selling. That business doesn't just build itself overnight. So, but tell me this, like from the entrepreneur perspective, you had to make that decision to go all in on your business and take on that responsibility of, I have to grow this business to a certain place so that I can be successful for my family as well, right? So what has it been like to go all in on your business, to commit to this route for yourself and figure out how to make it work? And why should the people that are listening not be afraid to take that same leap?
Well, I think part of it has to do with being an ex-banker, you know, like doing crunching the numbers. The first time I heard about direct primary care, to me, it was a no-brainer. At that time, I was in a fee-for-service clinic. I had two partners. We had, 25 employees, of which half of them were trying to collect the money. And it's like this is a no-brainer, because one, I can get paid every month, which that's great because now I have a steady cash flow. But two, I can kind of monitor or provide that I can be the doctor I want to be, I guess. And that's kind of the problem with the healthcare system, is trying to be that doctor. When I first started, I did what we call moonlighting. So I covered small town ERs 1 weekend a month. Now, I'm in a different stage of my life. I was 57 when we opened our clinic. So I had money in the bank. I could afford it. Wouldn't have had to, but I didn't want to pull money out of my savings to subsidize this business. Within about 2 months, 2.5 months, we were cash flowing, covering our expenses, but we weren't enough to be able to pull a salary out. And it was about 14, 15 months before I finally took any money out. We just let it build and build and build until, because we kept, we bought some equipment, we would buy things as we go. And, you know, you talk to a physician about buying stuff off eBay, medical stuff, and it's like, oh my God, there's great stuff on eBay.
Sure.
Instruments.
Yeah.
It's not like I'm a heart surgeon that I got to be,
Yeah.
using top of the line brand new equipment. So buying things like that, people talk. I looked at a cast saw from a medical supplier, was $1,400. I went out to Menards and bought one of those little oscillating saws for 49 bucks. That's my cast saw. So you learn, you gotta look around and think outside the box, not only how you provide service, but where you buy your supplies. And so taking that knowledge of looking outside the box, the direct primary care physician community is a very open and sharing community. So before I opened, I went and saw Ryan Newhoffel in Manhattan, Kansas. I went to Vance Lassie. I went to Atlas MD in Wichita. I went to Jennifer Herder, and just spent a half a day with all of them. How do you do this? How's this work? And so that just solidified that, this is the way to go. But if you're younger and you have a young family, you've got to figure out how you're going to subsidize when you start, because the last thing you want to do is go borrow a whole bunch of money, and that's been that's one of the biggest roadblocks to young physicians doing it, is they come out of med school residency with two, three, $400,000 in debt. And then they want to go buy a house, and then they want a new car, and blah, blah, blah. So it gets back to that money management of physicians. But that inhibits people from doing this. So having a plan as far as what I'm going to do to subsidize, Maybe I work at a nursing home. If I live close to a federal prison, I work part-time
Right.
at the prison. If it's, I can get on with the VA, I'll subsidize with the VA, or I'll moonlight at small town hospitals, which is what I did. That paid my bills, that paid my wife's and I living, so the business could continue to build itself. It took me, about 4.5 years to get to the point where I was making what I was making before I left the fee for service world. Um, every fall we meet with our accountant, and the last 2 years it's been like, wow, you're doing really well. And it's like, yes, we are, but it took time to get there. Um, but that's really the biggest thing is you've got to have a plan of how you're going to subsidize why you're growing your practice. And not everybody's as successful as a direct primary care physician. You've got to have you got to have that entrepreneurial kind of personality. So I went to a meeting one time, and she said, I don't know if I can do direct primary care. I just don't know if people will come to me. And the lady doing the presentation said, well, have you ever had anybody say, I'm going to bring my family member to you? And they do. Because you do a good job for me, I'm going to bring a family. Yes, she said. She goes, have you ever had a patient tell you you've saved my life? And she goes, yes. And she said, have you ever had a patient tell you that they love you because what you do for them? She said, yes. You'll be fine. Go open your direct primary care because you've got that relationship. Your patients can connect with you, or your customers connect with you. So people that don't have that kind of outgoing personality, it can be a struggle for them. I
Yeah.
think living more. I mean, our town here is about 30,000. Broken Bow's 4,000. Um, Living in a town of 30,000 to me would be much easier to build a practice than living in a town of 100,000 or 200,000. Just because it's hard to build those relationships like we're able to. A lot of physicians that are in the fee for service world will transition from fee for service to direct primary care. So I work for a healthcare system, but I'm going to go out and open my own clinic. Kind of the general rule is about 10% of your customers will follow you initially. At 6 months, it's about 30%. And by 12 months, you're up to where you're probably going to be at that 500 to 600 person. Because people get so frustrated with the healthcare system
Right.
that they start looking you up and say, God, I remember you did such a great job for me. You provided good care. I'm willing to pay my monthly membership to see you. We're seeing that right now. We've had a little bit of cold flu season with school getting back into session. We're having people call us. We'll do a one-time walk-in visit just so people kind of can understand what we do, how we do it. We kind of showcase our services. We're having people calling us every day saying, I can't get into my doctor who I've been seeing for 10 years uh, for 2 weeks because I got a sore throat, or my kid has an earache, or I think they have strep, or they've got a cough that they've had for 2 weeks. So we'll do a walk-in visit as a way just to kind of showcase what we do, and this is how we do it. And we give people, we'll do it once. Because if people don't want to pay the monthly membership, or people don't see the value of the monthly membership, I tell them you have what I call the urgent care mentality. And a lot of young people, like you were talking when you were 26, you don't get sick very often. I went to urgent care because I could walk in, get seen, get out. Urgent cares, the prices have really exploded. Um, and the one thing I will tell that I want to make sure people understand that are listening is healthcare prices are negotiable. If you go to the ER because you have to, I got in an accident, I ended up in the ER. I have appendicitis, I had to go to the ER. And you get the bill, you can negotiate that bill. Hospitals in our area right now will take, if you pay cash, they'll pay 50% right off the top. And so you have to understand that don't be afraid to negotiate when you're a small business, or when you are an employee of a small business, or you're an individual. Don't be afraid to negotiate. There's always been this fear of, well, I can't negotiate with my doctor because then next time I'm sick, he won't give me good care. He'll say, oh, I'm that problem patient. Or now, negotiation is part of the system. What I recommend. I always tell my patients, you gotta go to the ER, first call me. If I can't help you, you go to the ER when you get the bill. If you have the cash, you offer them 33%. If they don't take it, you offer them 50%. If they don't take it, say, well, go ahead and sue me, because by the time you go through small claims court collections, you're only gonna get 50%, and it's gonna cost you more than 17% to get there. So you should
Right.
have took my 33% offer up front, because that's gonna cover your cost. When you become a cash pay customer, I'm kind of getting off task here from your question, but it's something I think people really need to understand. If you walk into one of our hospitals and you need an MRI, say an MRI of your knee without contrast, with the MRI scan, the physician reading it, the hospital portion, it's going to be about $3,000. If you buy that up front off of a website called MD Save, same hospital, same MRI scanner, same doctor reading it, you can purchase that for $485. So 3,000 to 485, that is all waste in the healthcare system. That's
Right.
all middleman trying to get their cut of the pie. So that's the advantage. If you if you're a cash pay, even if you have insurance, tell them I'm cash. You just tell them I'm cash pay. I can't afford it. I don't can't afford the deductible. We have a lot of people also that do share plans. So there, you know, if you've heard of those, there's Christian share plans. We have one actually for our employees and for ourselves, it's Sedera. Um, so it's not it's not insurance. So you have a they don't call it a deductible, they call it an initial insurable amount. But you pay up to that, and then the bills get shared with the community. So say you and I are with the same company, I've been paying in, haven't had any claims. You, on the other hand, tore your knee out. And so you had to go to the surgeon, you got your surgery, you met your 2,500, whatever initial unshareable. The bills over that went to the company, they pull money out of my account to help pay your bill. And then if I get sick, then you have money in your account, they'll pull it out to pay my bill. So it's been around. The Mennonites, back in the 70s and 80s were doing this, you know, as a church organization. So that's one thing that's catching on more and more and more that we're seeing, because people can't afford insurance. So understanding that also helps when you're a cash pay customer.
For
So
sure.
kind of got off your question, your initial question, but it's just something I think is really important for people to understand in health.
No, I think it's all relevant to that first question anyway, because you're talking about really how do you know when to dive all in on something and attack it from an entrepreneur perspective. And I think your answer of all those things is just reflecting is when you're looking at solutions the way that you look at solutions, right? You're looking at different ways outside of the box to bring value to both the people within your organization and the people that are doing business with your organization. That's a pretty good sign that you're ready to take some of those entrepreneurial steps, whether you're at 0 customers or you're at, 949. You know what I mean? It's that you find yourself at some point in this entrepreneur journey asking yourself the right questions, right? You're asking yourself, what are the things that I need to do to run a successful organization, right? And at the end of the day, if you work really hard and you take care of your customers and you take care of your employees, a lot of the things can go right for you, as long as that you're asking yourself the right questions of how do I bring value to the people that trust me to bring value to them. So,
Well, I think on the
but no,
flip side of that, you also have to look in the mirror and say, this is my weakness.
right,
So for my weakness, I need to go hire or get somebody to help me with that. So maybe my weakness, I know nothing about business. So let's hire a CPA and let's spend time with them. So I understand the business side. So now I can go forward with that and take that off my plate. So I think you not only do you look at your strengths, but you have to look at your weaknesses as an entrepreneur. The idea I always want somebody smarter than me working with me.
right.
That's kind of the same kind of a thought process with what I think people should look at when they're looking at opening any kind of business, but
No, I
especially
can I
direct primary
completely
care.
agree. Yeah, no, I completely agree. It's and learning to be that reflective entrepreneur is an earned thing, right? It's a learned thing, and you have to earn it, and you have to put yourself in those positions to figure those things out. But I think what you do is really excellent. The idea of direct primary care in general, and how you go about connecting with your community in a way that builds your profile of customers, I think is really incredible. And I hope that more physicians honestly seek out the direct primary care route in the future, because I think that's going to cause some equalization of what we see in the fee for service world as well. But that's a whole nother conversation. But like I said, I hope that my organization can be some benefit to you, Dr. Jacobsen. If there's anything that we can do for you, please let me know. We'll put this conversation together in a really neat package, and we'll put it out to the world. And I hope we can get some people to hear it, because I think what you do is very unique, and people need to hear that, and it's an option for them as well.
Well, yeah, as an entrepreneur, it's a great option. As a small business owner, it's a great option, not only for just employees, but for individuals, but also the owners. Um, we have owners that they'll get a share plan and then they'll match it up with us. So they'll pay the monthly membership for their employees, and it'll be 40% of what an insurance premium would be. But their employees are actually going to get better care
For
because they're
sure.
not restricted from going, because they don't have to worry about this $5,000 copay or deductible. So that's what makes it so fun to be a direct primary care physician, is because, again, I'm actually able to help people. And, some people get frustrated. I get 30, 40 texts a day. I get maybe 10 patient emails a day. I might fill 20 prescriptions a day. And I might see 8 to 12 people in the clinics in a day. But I used to see 18 to 24 patients in a day, plus do all that stuff. So as a physician, it's very satisfying, number one, to be able to help people, because that's why I went into medicine. But two, to be able to enjoy what I do and be able to financially be where I was when I was working a heck of a lot harder and a lot more hours, when I was doing hospital work and upper and lower scopes and delivering babies and all those kind of things. So it's
Absolutely.
I mean, there you can look at, it's called DPC Mapper. If you Google that, you will find it will, and then put in your zip code. It'll show you all the direct primary care clinics close to you.
Oh, nice.
Yeah, so you could do that, and I don't know where specifically around Atlanta you are, but you might be surprised. There might be 2 or 3 already there that you've never
Sure.
heard of. But for you, your family, your employees, it's a great option. It really
Yeah,
is.
absolutely. Well, for you guys in the audience watching, I hope that you're able to gain something from this conversation. If there's anything that my organization can do for you guys, please feel free to lean on us. If you're going to reach out to Dr. Jacobsen, we will have all of the information about his clinic in Kearney, and the ways that you can reach out to him down in the episode description. But I'm excited to having met you. We spent some time up that way, and I'll reach out next time I'm somewhere in that area, and hopefully I can come shake your hand and meet you and see what you guys do in person. But I think it's really, really cool. And for you guys listening, I just encourage you guys to burn the ship. There are people out there more than willing to help you, to share their experiences, to find ways to be valuable to your organization as well. And it's a lot of fun. The gratification that you get out of thinking like an entrepreneur and building a business and building something, it's just a different thing. So if you're already thinking about it, you're kicking it around in your mind, you've taken the steps that you feel you need to take to begin finding out how to be successful. Don't don't fear that. Seek it out. You should really take that chance on yourself, because it's really the only way to find out if you're going to be able to be successful or not. So,
So
like I
here,
said, we'll edit this over a couple of days. I
Bailey,
encourage
here's
everyone to burn the ship. And if you have anything to leave us with, please feel free. This is your platform as much as it is mine. But everybody burn the ship, and we'll talk to you guys again soon.
so Bailey, one thing that I like to ask people is how's it going? People facetiously say, I'm living the dream. And the question I always ask them is, are you living your dream? Because if you're not living your dream, you need to do something different. And so as an entrepreneur, or somebody who's thinking about being an entrepreneur, whatever business that is, whether it's healthcare or your industry, if you're not living your dream, make a change, because
Absolutely.
that stress will just, number one, it will kill you internally. It'll kill you physically. It'll kill you mentally. It'll kill you morally. So that's what I always tell people. If you're not living your dream, you got to make a change till you are.